Hello, my name is Любовь Minyalenko. I work at the Department of General Practice Family Medicine of Zaporozhye State Medical University. And today we will talk about risk factors and screening of main chronic non-communicable diseases. The WHO priority areas is aimed at the prevention and reduction of disease, disability, and premature deaths from chronic non-communicable diseases, mental disorders, violence, injuries, and visual impairment. Non-communicable diseases, also known as chronic diseases, are not passed from person to person. They are of long duration and generally slow progression. The four main types of non-communicable diseases are cardiovascular diseases like heart attack and stroke, cancer, chronic respiratory diseases such as chronic obstructive pulmonary disease and asthma, and diabetes. Chronic diseases require chronic care management, as do all diseases that are slow to develop and of long duration. Non-communicable diseases, including heart disease, stroke, cancer, diabetes, and chronic lung disease, are collectively responsible for almost 70% of all deaths worldwide. Almost three-quarters of all non-communicable diseases deaths and 82% of the 16 million people who died prematurely or before reaching 70 years of age occur in low and middle-income countries. Risk factors such as a person's background, lifestyle, and environment are known to increase the likelihood of certain non-communicable diseases. They include age, gender, genetics, exposure to air pollution, and behaviors such as smoking, unhealthy diet, physical inactivity, which can lead to hypertension and obesity, in turn leading to increased risk of many non-communicable diseases. The WHO identified 5 important risk factors for non-communicable diseases in the top 10 leading risks to health. These are raised blood pressure, raised cholesterol, tobacco use, alcohol consumption, and overweight. The other factors associated with the high risk of non-communicable diseases include a person's economic and social conditions, also known as the social determinants of health. The term risk factor was first coined by former Framingham Heart Study Director Dr. William Cannell in 1961 article in Annals of Internal Medicine. There are two big groups of the risk factors: modifiable and non-modifiable. Although heart attack and stroke are major killers in all parts of the world, 80% of premature death from these causes could be avoided by controlling the main risk factors: tobacco, unhealthy diet, and physical inactivity. Low and middle income countries are more exposed to cardiovascular diseases risk factors, and their populations have less access to preventive efforts than people in high income countries. Cardiovascular diseases affect these countries disproportionately. Over 80% of cardiovascular diseases deaths occur in low and middle income countries. Cardiovascular diseases are a group of disorders of the heart and blood vessels, which include coronary heart disease, cerebrovascular disease, peripheral arterial disease, rheumatic heart disease, congenital heart diseases, deep vein thrombosis and pulmonary embolism, and so on. The main risk factors of cardiovascular diseases are age, gender, tobacco use, physical inactivity, excessive alcohol consumption, unhealthy diet, obesity, genetic predisposition, and family history of cardiovascular disease, hypertension, diabetes, hyperlipidemia, psychological factors, poverty and low educational status, air pollution. Currently practiced measures to prevent cardiovascular diseases include tobacco cessation and avoidance of the second-hand smoke. Smoking cessation reduces risk by about 35%. Also, a low-fat, low-sugar, high-fiber diet, including whole grains and fruit and vegetables. Dietary interventions are effective in reducing cardiovascular risk factors over a year, but the longer-term effects of such interventions and their impact on cardiovascular disease events is uncertain. At least 150 minutes per day of moderate exercise per week. Also, limit of alcohol consumption to the recommended daily limits, lower blood pressure if elevated, decrease non-high-level cholesterol. Statin treatment reduces cardiovascular mortality by about 31%. Decrease body fat in overweight or obese persons, and decrease psychological stress. Most guidelines recommend combining preventive strategies. The interventions aiming to reduce more than one cardiovascular risk factors may have favorable effects on blood pressure, body mass index, and waist circumstance. However, evidence was limited and the authors were unable to draw firm conclusions on the effects of cardiovascular events and mortality. For adults without a known diagnosis of hypertension, diabetes, hyperlipidemia, or cardiovascular disease, routine counseling to advise them to improve their diet and increase their physical activity has not been found to significantly alter behavior, and thus is not recommended. Simply providing people with a cardiovascular disease risk score may reduce cardiovascular disease risk factors by a small amount compared to unusual care. Systematic coronary risk evaluation or SCORE scale use high and low cardiovascular risk charts based on gender, age, total cholesterol, systolic blood pressure, smoking status with relative risk chart, while filters and instructions. You can see the benefits of the scale, which are based on a large data set tested through on European data. Operates with hard reproducible endpoints, such as cardiovascular deaths. Risk of coronary heart disease and stroke that can be derived separately. Enables the development of an electronic interactive version of the risk chart, and the score risk function can be calibrated to each country's national mortality statistics. According to this scale, there are such decrease of risk for cardiovascular complications. Less than 4%, it is low risk. 4 till 5%, moderate risk. 5 till 8%, high risk. Everything above 8%, a very high risk. The scale score contains two halves, the left half for women and the right for men. In each half, columns are available for smokers and non-smokers. The columns are made up for 5 large squares, age-appropriate, bottom-up, 40, 50, 55, 60, and 65. In a larger square, rows match the level of systolic pressure, and columns the level of cholesterol. The numbers in the cells show percent of risk of deaths in the next 10 years due to cardiovascular diseases. The WHO Europe assists countries in the WHO European region to develop national programs for cancer control. The International Agency for Research and Cancer is the WHO body that specializes in this field. It coordinates and conducts research on causes and develops scientific strategies for cancer prevention and control. Cancer causes 20% of deaths in the European region, which more than 3 million new cases and 1.7 million deaths each year. Cancer is the most important cause of death and mortality in Europe after cardiovascular diseases. Cancer is in many cases avoidable, and early detection increases the chance of cure substantially. Enough is already known about the causes to prevent at least one-third of all cancers, and some of the most common types, including breast, colorectal, and cervical cancer, can be cured if detected early. Globally, more than 70% of all cancer deaths occur in low and middle-income countries, which have few or no resources for the prevention, diagnosis, and treatment of cancer. Regardless of resource level, all countries can implement the four basic components of cancer control: prevention, early detection, diagnosis and treatment, and palliative care, and thus to avoid and cure many cancers as well as palliating suffering. The most important risk factors for developing or accelerating preventable chronic respiratory diseases are tobacco smoke, indoor air pollution caused by mold, dampness, tobacco smoke, or the burning of biomass fuels, outdoor pollution, allergens, low birth weight, poor nutrition, acute respiratory infections in early childhood, occupational dust, and chemicals. Socially, economically, disadvantaged populations in low and middle income countries are especially vulnerable for the development and exacerbation of respiratory diseases, in part because they are more exposed to indoor solid fuels and unsafe occupational environments. Occupational chronic respiratory diseases are often not adequately recognized as a problem. Treatment drugs are often unavailable or not affordable. Tobacco use tends to be higher among poor people than among wealthier members of society. Diabetes is a chronic and largely preventable disease that can lead to cardiovascular disease, blindness, kidney failure, loss of limbs, and loss of life. It causes suffering and hardship for the approximately 60 million people in the European region currently living with the disease, while also straining the region's economies and health systems. On this slide, you can see modifiable and non-modifiable risk factors of second-type diabetes mellitus. As for non-modifiable risk factors, they are history of gestational diabetes, race or ethnicity, age over 45 years, family history of diabetes. To modifiable risk factors, we can say physical activity, high body fat or body weight, high blood pressure, and high cholesterol level. Obesity is one of the greatest public health challenges of the 21st century. Its prevalence has tripled in many countries of the WHO European region since the 1980s, and the numbers of those who are affected continue to rise at an alarming rate, particularly among children. In addition to causing various physical disability and psychological problems, excess weight drastically increases a person's risk of developing a number of non-communicable diseases, including cardiovascular disease, cancer, and diabetes. The risk of developing more than one of these diseases, a comorbidity, also increases with the increasing of body weight. Obesity is already responsible for 2 and 8% of health costs and 13% of deaths in different parts of the region. Here you can see a classification of body type based on calculated body mass index. So when person body mass index is less than 18.5, we can say that the person is underweight. The healthy and normal body mass index should be from 18.5 till 24.9. We can say that person is overweight when his body mass index is from 25.0 till 29.9. And we can call that patient has obesity if his body mass index is over 30. As pictured, there are strong relation between body mass index and risk of coronary heart disease diabetes in both men and women. For example, risk for coronary heart disease are 2 times greater in women with body mass index over 26, and also risk for diabetes is 8 times greater. Gastrointestinal diseases risk. You can see the risks include junk food, stress, smoking, sedentary behavior, chronic intoxication, occupational factors, genetics, and of course infection of Helicobacter pylori. Peptic ulcer risk is high in case of imbalance of factors that protect stomach, such as mucus, bicarbonate layer, blood flow, cell renewal, prostaglandins, tight junction by the epithelium, and the factors that increased acid secretion, such as acid, pepsin, bile acid, Helicobacter pylori, alcohol, pancreatic enzymes. The risk factors of urogenital diseases are flu and hypothermia, genetics abnormalities, traumas, physical overload, infectional diseases, poisoning, drugs intoxication, cardiovascular disease or some internal diseases, pregnancy, and neoplasms.